Hello, Carl. My name's Maddie.
Hi.
How are you doing today?
Good.
Good. So I'll be your PT, and I kind of looked over some of your history, and it looks like you've had a long time of pain and discomfort.
Yeah.
And you've tried a ton of different things, which I'm sure is super frustrating, and you just can't find something that works. So for me, I just really want you to kind of start fresh with your pain and don't think about all those things that have happened in the past. Just kind of have a new mindset, and we're going to work on some different things, and we're going to introduce you to some different modalities.
Okay.
And we're just going to work with you and collaborate and keep you comfortable while we're working to progress your functionality. So
Okay.
really with your plan of care, we first off would like to collaborate with you, and we don't want to push you too hard to create more pain or more issues, and we want to give you the resources and the education that you want to know in regards to your fibromyalgia and your sciatica and the other pains that you've been experiencing. So with that education, that's going to be a big part of you kind of getting a better hold on your pain and what's going inside of your body. So we'll actually start with some education today.
Okay.
And then with fibromyalgia and with just chronic pain in general, activity is really important. Most people don't think that, but it's really kind of teaching your body to respond to stimulus to a less degree, and then increasing your functional abilities with that. So we're going to just slowly...
I've had a doctor who told me not to
move, right? Yeah, so that's really confusing. So we're going to try to rethink all of those kind of things.
Okay.
And so we're going to increase activity, but it's going to be slowly, and we're just going to progress for what you're comfortable with. We don't want to push you at all.
Okay.
We can also talk about some potential referrals. There's a lot of other health professionals that can be a benefit to you in your situation. One big thing with fibromyalgia is cognitive behavioral therapy, which psychologists are really good at, and they basically are training you to rethink your pain experience. So we can talk about that. There's also we could talk to some pharmacists to go over kind of medications and what would be best for you.
Okay.
Also, relaxation is going to be a big thing, because I know with your pain, you've kind of started guarding your movements and you've tightened up muscles in order to prevent the pain, but then that's actually leading to more pain. So we're going to teach you how to relax and relearn how to kind of sit and move in a way that's more comfortable and more relaxed, which will lead to less pain.
Okay.
Overall, our goal is to just get you to be more functional and lead to a better life, more fulfilling, get you back to those things that you want to do.
Okay.
Also, so to start kind of with the pain science education, basically when we're kids, we kind of learn that pain's a bad thing, and if we are experiencing pain, we need to remove our hand from the hot stove or kind of avoid whatever caused the pain. And with time and with repeated stimulus, this can kind of mess with our nervous system and our perception of pain. And so pain receptors in the body kind of give us a threat signal, and then it comes from our hand up to our brain. Our brain notices that something's happening and kind of sends a response back down to the hand, and can signify that it's pain or have it move or whatever. But with time, your body becomes more sensitive to different stimuli. So if certain receptors respond to stresses, and then that leads to pain, that's pretty normal. But eventually you can have your body, other receptors that are supposed to signal different kind of messages, can then start signaling pain to your brain. So then everything starts creating pain. So say you have a stressful day, you'll have more pain, or someone yells at you at work, you'll have more pain. So your body just kind of has these different signals that are interpreted as pain, and they increase your pain, and then your body becomes hypersensitive, and you get in this cycle that's just super debilitating.
So is this not actually pain?
It is pain. Your body is reading it as pain, and it is pain, and it's real, but we just kind of have to let your nervous system know that it's not actually causing any tissue damage, because with acute injury, your tissue damage and your pain are synonymous.
Okay.
But tissue damage heals itself within 2 months on average. So pain after that is actually not causing you any more tissue damage. It's just kind of your nervous system and your stimuli are getting confused for pain. And you may think that your tissues are getting damaged more, but really it's just the signals that are relaying pain to your brain. But
Okay.
so yeah, so we need to go through all of those things. We have some great resources that will teach you kind of the different receptors and like how many nerves there are and things like that. And we kind of want to work away from this kind of cycle of catastrophizing your pain, fearing the movement, which happens with your guarding and your tight muscles, which creates more pain. And then I'm guessing, have been avoiding moving because it's caused you more pain.
Yeah, pretty much sit all day.
Yep. And then, so then you feel disabled, you can't really use anything, and then that creates you to just feel depressed because you can't really do much other than just sit there. So we want to get you back to doing those things that you like to do, the gardening and the cycling and stuff.
Okay.
But we need to do some steps before that so they don't cause you any pain. And then with that, we can work towards the other side, which is non-catastrophizing, just taking the pain as it is and working through it and retraining your brain. And then you can kind of confront the pain and work through it and then hopefully get you to recovery. But also with this, the fibromyalgia, we aren't aiming for no pain at all because that disease is characterized by just all over pain, fatigue, and sleep problems. But we're going to teach you ways to get you to a more functional state. And just with goals, like we do want to decrease the pain, but our focus is going to be more on increasing your ability to function.
Okay, so I'll still have pain, but then I'll also be able to do the moving.
Yeah, so pretty much goals are to retrain your brain to think about the stimuli that are coming in differently and not take everything in as pain, but as whatever it actually is. So that's going to take a little bit of time, and then we're going to slowly get you moving more and get your muscles relaxed and your body in a better form. And then from there, we'll move towards just being more functional and more active and see what else you need along the way.
Okay, sounds good.
Perfect.